Hey there, and welcome back. Thank you for tuning in to my video series about evaluating abdominal pain in the emergency room. And this is actually part 6. So there's 5 other parts that you can go back to my channel and watch those, and you'll get some great information on parts of the abdomen. If you're having discomfort there, what could be causing it? And like I said, today is part 6, and I'm going to be focusing on the left upper quadrant. So in the area just under your left ribs, what are the conditions that could be causing you to have discomfort in that area? That's what I'm going to be covering today. But first, my name is Andre Huey. I'm a physician assistant, and I work in the emergency room taking care of patients, and abdominal pain is something very common that I see in the emergency room, and I have for several years, and several thousands of patients have taken care of abdominal pain. So I've done a series of talks about some of the common problems, or the most common problems, maybe not all inclusive of every single condition, but pretty close. And I try not to put down the treatment plan for these conditions, because I think it's really important for, if you're having pain, for the medical provider that you're seeing for that pain to be the ultimate one to discuss with you what the treatment plan would be specific to your situation. I may mention a couple of things, but I typically defer that to your specific situation and then the medical provider who is seeing you at the time. And very quickly, we talk about quadrants of the abdomen. And I'm talking about the left upper quadrant today. In past videos, I've discussed how we come up with those quadrants, so you can refer back to those. And there will be links at the end of this video that will take you back to some of those videos. And watch that, and you'll get a better understanding of what I'm talking about. Also, go ahead and subscribe to this channel. That would help me out a great deal if you'll do that for me. And as you're listening to this content, think about a comment that you can give me in the comment section about this information, maybe something else you would like to hear about pertaining to the emergency room, or maybe an experience that you've had, or would this information have been helpful had you had an emergency room experience or had abdominal pain. So let's jump right into what are some of the conditions that can happen that would cause you to have discomfort or pain in your left upper quadrant area of your abdomen. The first one is going to be constipation. Now, constipation, you can have pain really anywhere in your abdomen, but the left upper quadrant is one of the common areas that you can hurt. And basically, constipation, I believe everyone knows what that means. It just means you're backed up. You need to poop more. So your medical provider, depending on how bad you're hurting and how bad how bad you're backed up, they're going to give you a recommendation. Maybe that's as simple as drinking more fluids, getting more activity, increasing your fruits, your vegetables, your fiber in your diet. It may be some prescriptions or recommending over-the-counter medications. Sometimes people are so severe that they have to end up getting enemas. But again, that's up to your specific situation. The next thing that could be causing your pain in the left upper quadrant is maybe you have some pain in your spleen area. The spleen is up in that area, and if it becomes inflamed, if it has a decreased blood supply to that area, that could be causing pain in the left upper quadrant for you. You may not think about the next item would be a pneumonia, an infection in the lower part of your lung, irritating areas just in your left upper quadrant, making you feel like you're hurting in your left abdomen, or you are, but really the cause of it is a pneumonia in your lower part of your lung. And that a lot of times can be diagnosed through chest x-ray. Sometimes it's seen incidentally on CT scan. Pain that you're having in your left upper quadrant of your abdomen could be related to your heart. It could be a heart attack. You could be having inflammation of the sac around your heart, or you could have fluid in the sac of your heart causing the pain in your left upper quadrant. And again, that is diagnosed by your medical provider through multiple different things. One is your history, listening to the description of your pain. Sometimes it's diagnosed through imaging, through blood work, and through physical examination. If your medical provider is suspicious enough and you meet the right kind of risk profile, maybe you're the right age, you have the right history, you've had a heart attack before, or you've had inflammation around your heart before, they may order an EKG, they may order cardiac enzymes. So it's really specific to your situation, but that is something that can be causing pain in that area, and to keep it in mind. Another significant thing that can cause pain in your left upper quadrant is if you have a blood clot in the lower part of your lung, basically on that side, the left lung. It's called a pulmonary embolism, and those a lot of times are diagnosed by a special CT scan called a CT pulmonary angiogram. The next item on the list can be bowel spasm. You could be simply having something similar to, or definitely, irritable bowel syndrome, which is a functional bowel disorder or syndrome where your bowels are more spastic and they're more sensitive to the spasm and other conditions, which makes you more aware of it and makes you have more discomfort in that area also. Next, there's something called ischemic bowel. That's where blood flow to part of your intestines is decreased or diminished, either enough to irritate the bowel, sometimes completely. Sometimes it's fleeting, means it happens and then goes away back to normal, but your bowel is still irritated, still painful. Sometimes it can cause bleeding when you poop. You can have some bloody diarrhea. That's called ischemic bowel. And that can be a significant issue, and it's up to your medical provider. That's one thing that they would be looking for when someone having abdominal pain. And then also they look at your risk factors as well, which would be diabetes, or if you're a smoker, or of older age, or if you're a female on birth control. A urinary tract infection would be the next thing. We all know what that is. You have an infection in your urine, it can cause you to hurt up high sometimes. Antibiotics and pain control is treatment for that. Sometimes in women, and it also can happen in men as well, but it's more rare, I would say. But you can have an infection that is either rapidly progressing in your urine, or maybe you weren't aware of it and it has continued to worsen, and now it's gone up your ureters into your kidneys and made your kidneys swell and get infected. And that's a condition called pyelonephritis, and that is something that could also cause you to hurt in your left upper quadrant. And a lot of times you'll also be hurting in your side and also your back as well because of the swelling in your kidney. That condition, you can go home with that, with pyelonephritis, but it's really up to the medical provider who has diagnosed that to make the ultimate decision, because there are some cases of that where you would need to be admitted to the hospital for IV fluids, IV antibiotics, and pain control. The next item would be a kidney stone. And really you can have pain on either side depending on where the kidney stone is, but since we're focusing on the left upper quadrant, it's a very real area where if you have a stone on that left side that has dropped out of the kidney into the tube, the ureter between the kidney and the bladder, once it starts moving, it can cause significant pain. You can also have nausea and vomiting. And those are diagnosed through history examination, also looking for blood in your urine, and then a CT scan would show the actual stone. Sometimes something as simple as a pulled muscle can make you hurt in the left upper quadrant. You could have a pinched nerve. You could have pain that's radiating around from your back from a disc problem, maybe a bulging disc or something like that. So that's called musculoskeletal pain. If you have a rash in that area, you could have zoster or a shingles rash. That is a rash caused by the herpes virus. So if you've had chickenpox in the past, that is caused by a herpes virus. And once that chickenpox goes away, the herpes virus does not go away. It just goes dormant or goes to sleep deep in our skin at the base of the nerve roots, and it can wake up really at any time for various reasons, and it presents itself on the surface of our skin in a very painful, raised, itchy, stinging rash, and it's usually one-sided. It can happen anywhere on the body, but it's usually one-sided, and it does not cross the midline on the front or the back. And that's how we know that it is a shingles rash. But it can commonly happen on the side of the abdomen, one side or the other. So keep that in mind as well. And the last item on my list that can cause pain on the left upper quadrant is a condition called colitis. Now, this is either an inflammation or an infection in your intestines. It causes swelling. It can cause diarrhea. Sometimes it can cause constipation. Sometimes it can cause bleeding with your diarrhea. It just really depends on what the ultimate cause is. And sometimes it can be caused from a virus. Sometimes it can be caused from a bacterial infection. Sometimes medication can cause that. And then sometimes it can be more of an inflammatory bowel problem, like ulcerative colitis or Crohn's disease. A lot of that is determined through your medical provider asking you questions, looking at your history, and also through the blood work and the CT imaging that is done to evaluate your discomfort. It'll show swelling in your intestines, and a lot of times the radiologists who are reading these CT scans, they know what they're looking at, they know what your bowel is supposed to look like, and they, over the years of training and reading, they know what colitis looks like. So they give us a reading back, and then we go back and look at the scan also to see that. And they'll say, hey, this looks like this person has colitis, and then we come up with a treatment plan for you. And a lot of times it's referring you to see a gastroenterologist as an outpatient if you don't need to be admitted. But ultimately, that treatment plan, those decisions will be made between you and the medical provider who is seeing you at that time with this particular condition and all the others that I mentioned. So very briefly, that's the conditions that can be causing you to have discomfort in your left upper quadrant. And a lot of these overlap. A lot of them can make you hurt in other areas of the abdomen as well. But if one day you wake up or you're doing about your daily business and you realize you're having pain in your left upper quadrant, then this gives you an idea of what that could be. So thank you for watching this video to the end. Please subscribe to this channel. That would help me out a lot. Like and share this video with your family and your friends, as they can also benefit from this information. Drop a comment, as I mentioned earlier. I'd love to hear from you. And check out the links that should be appearing above me now to other videos on my channel. And I look forward to talking with you soon. Take care. Thanks.